name is Farah Kiddy and I'm a GP in Leicester and a public health trainee in the West Midlands area of England.
Hi there, I'm Deirdre Harrington and I'm a lecturer at the University of Leicester. So obesity is a well-established risk factor for a number of chronic conditions. It's very important to have measures that allow us to identify those who might be at risk of chronic conditions due to excess adiposity. Anthropometric measurements such as body mass index and waist circumference are commonly used in research, public health and in clinical care. A lot of these anthropometric measurements have not been fully tested in a variety of ethnic backgrounds, in particular ethnic backgrounds who might have a higher risk of developing chronic conditions in the future.
This is where our paper comes in. It is entitled Association between Anthropometric Measurements and Cardiometabolic Risk Factors in White European and South Asian Adults in the UK, and it will be published in an upcoming edition of the Mayo Clinic Proceedings. In this study, we analysed data from the EDITION study, which is a large international multi-centre study looking at the feasibility of screening for diabetes and later on looking at the effects of an intensive treatment regime in those with screen-detected diabetes. We looked at the data from the first phase of the study in which people from the general population who were not known to have diabetes were screened for the condition. The anthropometric measurements we looked at were BMI, waist circumference, waist to hip ratio and waist to height ratio, and our outcomes of interest were hypertension, dyslipidemia and dysglycemia. After exclusions, our study included 6,268 participants, about a quarter of whom were South Asians. In Leicester, there was a particular interest in including the South Asian population in the study since we have a large South Asian community and there is a paucity of data in this ethnic group. What we found was that for each anthropometric measurement, there were increases in the odds ratios of developing the outcomes of interest. However, these increases were modest, although statistically significant. As you can see on the slide, the odds ratios differed both by anthropometric measurement and by ethnic group. However, these differences were not significant. In addition, we calculated the receiver operating characteristics for each of the anthropometric measurements in the cohort as a whole and then by ethnic group. In each case, the results were found to be less than 0.7, which indicates low accuracy. As can be seen on the next slide, the cut-off points for white Europeans and South Asians were different, and in the case of BMI, waist circumference and waist to hip ratio, there was a significant difference between the cut-off points between white Europeans and South Asians, with South Asians being generally lower. However, the sensitivity and specificity of these measurements was at best modest.
Although there were some statistically significant differences in how these measures performed, no clear pattern was seen and they all performed similarly low. From a research perspective, our data contribute to the data available on how anthropometric measures perform in a number of populations, including populations of South Asians in the UK, who again are at higher risk of developing chronic conditions, including type 2 diabetes, and often develop these at a lower level of these anthropometric measurements.
And clinically, we're really only interested in measuring people in order to make an accurate risk assessment. So with each of these anthropometric measures performing equally poorly, there's no great push to choose one over another based on the findings from our studies. We've also shown at a pragmatic level that any one of these measurements could be used at a population level as part of a screening programme.
If you'd like to know more about our research and education here at the heart of clinical care at Leicester Diabetes Centre, please do get in touch.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.